Hi, I'm Dr. RAMYA JAYARAM. I am an infertility specialist and reproductive surgeon at Women's Center by Motherhood Coimbatore. So when I talk about fibroids, there's not just one type of fibroid that we need to think about. There are different types of fibroids, and whatever symptoms a lady has totally depends upon where this fibroid is in the uterus, how big it is, and what is the distance between the fibroid to the cavity of the uterus. When I say cavity of the uterus, that is where the bleeding comes from, and that is where a baby will grow. So if the fibroid is completely inside the cavity of the uterus, it is called a submucous fibroid. If it is in the body of the uterus, it's called an intramural fibroid, and if it is superficially lying on top of the uterus, it is called a subserous fibroid. Generally, women who have heavy bleeding but without any pain usually have something what we call as a submucous fibroid, which, like I said, is inside the cavity of the uterus. If she has pain, severe pain during her cycles as well as heavy bleeding, it usually means that she has a fibroid which is in the body of the uterus, that is an intramural fibroid, which is also possibly pushing into the cavity of the uterus and thereby causing heavy bleeding as well. A lot of women who have the subserous fibroids, which are around maximum 4 or 5 centimeters, may have these fibroids and they may not have any symptoms at all because they are superficially on the uterus, and it generally will not cause any symptoms like pain or heavy bleeding, and this fibroid will just be there, and a lot of the times it's just incidentally picked up when we are doing a scan for something else. But if these same subserous fibroids are very large and they start pushing on the bowels at the back, or if they start pushing on the urinary bladder in front of the uterus, then a lady can start having symptoms such as difficulty passing urine, or she may have frequent passage of urine depending upon exactly where the fibroid is pushing on the bladder, or if it is very large and pushing on the intestines, then she may have even difficulty passing motion. So we cannot take it for granted that if it's a fibroid which is superficial, it is not going to affect her in any way. Definitely, the evaluation has to be done, and depending upon the size of the fibroid, we need to take a decision on treatment. And a lot of the times, women come to us with difficulty conceiving, and when we do a scan, we find that there are fibroids either in the mouth of the uterus, that is the cavity, which we call submucous fibroids, and a lot of the times these submucous fibroids will affect fertility because it will not let an embryo implant and grow. It will affect, even if an embryo implants, it may affect the blood flow to the embryo, so the embryo can't grow beyond a certain point. Or if somebody conceives in spite of having the submucous fibroid, there is a very high risk that she will have a miscarriage because the fibroid will not allow the uterus to support the growth of the baby. And sometimes when they have intramural fibroids as well, that is fibroids which are in the body of the uterus, these fibroids can still have the same impact on pregnancy depending upon the size and how much they are pushing into the cavity where the baby is growing. It can impact pregnancy or even impact the lady's ability to conceive.